Morning and thanks for the invitation. So my name's Stephen Lock. I'm the interim Chief Information and Technology Officer at something called the National Institute for Health Clinical Research Network. And I'm going to tell you a bit of a story about what happened to us through the COVID-19 experience. And then hopefully we'll have a bit of time. We'll actually show you a dashboard, or got an image at the very least anyway. Yeah. We've also got Rory McHugh, who's joined this morning, who's actually the person that built most of this stuff. So it's brilliant that we've got him here. So the story, what happened? Right. Starting at the top left, that's where we're normally based in Leeds. And one of the ways that we would informally describe ourselves in the past was as being the best kept secret of the NHS. The reason for that is that nobody'd ever heard of the National Institute for Health Research until recently. And yet we're a pretty big organization. The part that we are called the Clinical Research Network, we fund around about 7,000 staff up and down the country. We're in every single NHS trust in England. We have links to the devolved nations as well. And what we're there for is to provide the infrastructure for running clinical trials. And what that means usually is that we fund 15 regional organisations. They in turn support NHS trusts by giving them usually research nurses. And that means that when you find yourself coming into hospital and you are sick, somebody would approach you funded by us and say, are you aware? You may not be aware, but you potentially eligible for a clinical trial. Would you be interested in participating? Our role from that building in Leeds is to run that system nationally. And as part of that, we have a small but beautifully formed business intelligence team. Consists of around about 6 analysts. And then there's a few other people that do roles around things like data quality and so on. And that's where we were when COVID hit. And then, like many of you, I'm sure, we very, very quickly ended up working from home. In fact, we were about to plan in February to do a little test of whether half of our organization could work from home when the announcement was made that we should probably all do it. So the next day, very few people walked into that building, but if they did, they walked out with screens and cameras under their arms and went home. And that's where we've been ever since. As you can see, I'm still there and where we're going to be for a while longer. Pretty quickly, the government announced that its strategy for solving research had several arms to it. And one of the most important, one of the important ones was research, because as you'll all be aware, the only ways we're going to get out of this situation is if we find a treatment or a vaccine or a cure that really, really helps. So we dedicated ourselves to that task and were pretty quickly asked by the government to change our emphasis to make everything that we did primarily about what we call urgent public health. So that's any kind of research that was going to help the current crisis. We didn't suspend everything else, but you'll be well aware that hospitals emptied and other treatments were cancelled. So it's difficult, for example, to run a cancer trial in a hospital if cancer services are not running. So our normal work, which would usually see us recruit around 800,000 people a year into different trials and studies, was severely affected. But as a national body, we moved to doing this. So quickly, we formed this thing called CABRA. Now, you'll have heard of COBRA, gets mentioned on the news, which is, the government's emergency response thing. So our organization formed CABRA, which stands for the Kitchen and Bedrooms Research Advisory Group. But this was an incredible thing that happened. So we had at one point around about 80 national experts. So you're talking about some of the most eminent researchers and doctors and epidemiologists in the country joined this group to rapidly look and see if there was any potential research that could be delivered. Now, bearing in mind, with a fair wind, most research studies would go from concept to recruiting a patient in about 18 months. This group was formed in about 5 days, and then it approved its first study around about 5 days after that. So there was an astonishing effort to make that work behind the scenes. And that's where my little image there of data wrangling came in. Because everybody in our organization suddenly had to work in a new role, had to do something different. And that included everybody in our business intelligence team. In the beginning, what that meant was, frankly, just helping to support that process. And the team used its skills at wrangling spreadsheets, basically, Google Sheets. So we built a research application system on the back of, the less people know about how that was done and sausages are made, the better. But essentially, we used our skills where we could to support those people in their kitchens and their bedrooms to make rapid, really important decisions about COVID clinical research. Once we'd established that process, it was flooded with inquiries. They have had to review hundreds. They met 3 times a week in the evening and on weekends. Quickly we ended up with a portfolio of research that we could work on. And then our role as an organization was to deploy that across the country as quickly as we possibly could. Now, in normal times, our business intelligence team is fantastic, does a wonderful job. But what it is asked to do and tasked to do mostly is retrospective reporting. It's saying what happened last week or last month or last year, and it's often about KPIs and that kind of thing. Now, the team is capable of much more and does much more rich analysis than that, but that is kind of what the ask is. But suddenly we found ourselves right in the middle of a national crisis. And that's when NHS England came in. Now, we have a database that contains around about 10 years worth of data on research activity, is what we would call it. So where have studies opened? Where did they recruit participants? When did they close? That kind of stuff. And we can build dashboards and things around that. But what was really, really crucial in the middle of the crisis was that we got ahead of what happened as well as we could. You can imagine that the Department of Health wanted to know, have you got this study open now? Is it going to open tomorrow? Have you recruited any participants? Because they were being asked daily, hourly by the media, what are you doing about this? That meant that we had an opportunity, but also quite a lot of pressure. So what we did was we rapidly built a brand new dashboard that took the data that we had. We put in a new process to collect information. We would normally collect information on study recruits, either be a mixture, but many studies would only do it once a month. And we went on these studies to ask for a daily update, which you can imagine the processes behind that were interesting, all done at speed. And we built a dashboard that allowed people to see where research was taking place or where the first participants were recruited. Now, that then quickly led us to be quite visible and known as the only people who could say anything about what was going on with research in the country. So our dashboard became the source of truth for the UK government pretty quickly, which is scrutiny that we're not used to, but I think we could probably say that we enjoyed it some of the time. Now this really changed, and it went up a level when we were able to develop a better relationship with NHS England, who we've worked with previously, but they were also rapidly changing all of their systems and processes, and they were able to supply us a daily feed of data on where patients had been admitted with COVID-19, exactly which hospital they were in, how many people were on a ventilator, how many people were in a critical condition, and so on. And we could then feed that into our data. So we could say exactly where patients were being recruited, but more importantly, we could say, this is where the patients are today. This is where there's a cluster. And that totally changed the game for our organization and changed the way that people think about the way that research can be delivered. I put the image there of Boris Johnson and Chris Whitty and Patrick Vallance, because I'm sure back in the day you were all glued to the daily briefings. I'll tell a little story about what happened to us. We built this dashboard and we managed to get the daily data, and that meant we could report it. We did that for internal management purposes to help those 7,000 staff to plan what they were doing. But news spread to the Department of Health that we could do that. And I woke up one morning and logged on about 8 o'clock. And somebody said, could you do this daily and send it to the Department of Health? And I said, well, yes, I think we could. By 10 o'clock, somebody in the Department of Health had said, we really want you to do this. By about 1 o'clock, we'd formally agreed to do it. by then, we then had to tell the team, look, we're going to have to do this, do a daily report that is going to the Department of Health. It has to be the source of truth. It has to be 7 days a week, which is not the way we normally work. And it has to start from tomorrow. It was a Friday just before a bank holiday weekend. And then at 5 o'clock that day, we found that as people kept being added to the mailing list of who wanted to receive it, and Chris Whitty's name made it onto the mailing list at about 5 o'clock. So we went from being, a small team in the best kept secret of the NHS to right in the heart of what was going on with the coronavirus pandemic. And data was at the heart of it. And data linkage was what made the difference. So I mentioned that we got data from NHS England. We also started to feed in information from Public Health England on where people were being tested and the results of tests. And we already, in the background of our dashboards, we have data from ONS on population and so on and so forth. So what happened? Well, to this morning, I went and had a look at the dashboard. We've got more than 175,000 participants in COVID research. I'm pretty confident that that will be many more than anywhere else in the world. The sad truth is we had a very high incidence of COVID-19. That meant there were more people that you could recruit into research, but we did it incredibly effectively. The CABRA group approved 58 studies, and we recruited 12,000 participants to the recovery trial. The recovery trial is the one that made the news, and here's a tweet from Chris Whitty saying that this was the first real study in the world that showed a significant difference in reducing the risk of dying. And in fact, we saw a treatment effect from dexamethasone that you don't normally see in clinical research. The numbers have gone out of my head, but it's something like 1/3 of people who find themselves on a ventilator and more will survive if they are given this drug. That's an incredible treatment effect. The BI team is now become central to research planning. So people use our dashboards to decide where to open research, because we can say, this is where people are testing positive. This is where they're being admitted. This is where there are study sites open. Don't open one there because there's a conflicting one. And we're now actively part of the planning for COVID vaccines research. And this is a separate thing. I don't think our team can claim credit for this, or we've contributed to it, but I'd encourage you to take a look at the website address that I put there and be part of research, because we've built a registry where you can volunteer to be contacted if vaccine research becomes available in your area. And we've got more than 225,000 volunteers for that in a very short period of time. I'm probably duty bound to say that if you sign up for that, then you would be properly consented into anything if they ever contacted you, and you would be guided through all processes. But if you feel like you would like to contribute to this effort, then please sign up there. So that's it for our story.